Doctor, I'm having a means. I want to ask, why is getting second opinion important when dealing with serious health issues?
I think that is because everybody has different style of practice, and most of us as physicians will try to uh, practice in a way that we are practicing evidence-based medicine, and some not everybody responds to the same treatment in a similar fashion. Every patient is different. They can respond to different medications or different surgical treatment differently. So sometimes when you are in doubt about like what is the best option for you, and you may not be satisfied with the answer that your physician provided, I think it is very reasonable to reach out to and get a second opinion. And that's what I tell my patients to you. Sometimes if they come and I talk to them about something, and they are not sure if that's the right thing, I always offer them an option to go see one of my partners if they want to get a second opinion. And if they hear the same thing, and they'll sometimes come back to me and get the treatment from me itself. But I think getting that second opinion kind of reassures them. So for an example, I would say, like, I had a patient who came to me, and her the reason for the appointment was I was told to have a hysterectomy. And she's a woman in her 30, pretty young. And I was like, why do you need a hysterectomy? And she's like, oh, ever since I had my sterilization, like the tubal done, I'm having heavy bleeding. And one of the doctor told me that I should get a hysterectomy to fix the bleeding. And then I was, going through her history and everything. She was on birth control prior to her sterilization procedure. So obviously, that was regulating her menstrual cycle. And once she had the sterilization procedure, she's no longer on the birth control, and that's causing her heavy bleeding.
Okay.
And I talked to her about different options, and we finally, made a joint decision to proceed with the Mirena IUD. And that patient has kept her uterus, and she's doing really well. And she did not end up with an unnecessary procedure because someone told her she needed a hysterectomy.
Yeah. Okay, doctor. Thank you for this information. Means that will be very much useful for our users and for the audience also to get a second
Mhm.
opinion.